Good morning and welcome. We are at the top of the hour, so we are going to begin here. We're excited to have you joining us this morning. It's a little extra special because April is Month of the Military Child, so we're going to be really honing in and focusing on um, our military families, even more so during this month. So we're excited for some of the things that we're providing. All right. So my name's Rachel Browner. I am the program coordinator for OneOp. Um, and today's session is on TRICARE Echo Demystified, Eligibility, Enrollment, and Effective Support Strategies. In case you're joining us for the first time, I'd like to give you a brief tour of our webinar platform to find your way around. Hopefully, you are currently able to view the slides we're sharing. If you're unable to see them or if you have any other difficulties, please email us at contact@oneop.org for tech support. And as some of you who's already done, you've begun typing in the chat to let us know maybe where you're from, or you've already wished us some good mornings. We appreciate that. And we look forward to having you join us in this chat pod for conversations and questions. So for those of you that are unaware, to embed that chat pod so you don't miss any links or conversations, simply place your cursor over that shared slides. You'll then see a toolbar pop up across the bottom of your screen. And from there, just go ahead and click that chat bubble icon. So when typing questions or comments, please be sure to select the Everyone from the Response Options drop-down menu so everyone's able to see them in that chat pod. And note that the slides and resources are available for download on the event page for today's session. I believe my colleague Kathleen has posted that link in the chat, so you might have to do a little scrolling up to get to that link, but that is in the chat. And we'll be covering continuing education information at the end of the webinar. So please stay tuned at the end. So if you're interested in receiving CE credits or a certificate of attendance, we'll be going over that briefly at the very end of today's webinar. And finally, closed captioning is available for this webinar. You can turn on subtitles if you need it via that Zoom toolbar. Also, we just want to remind you, thank you again for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand that readiness, knowledge, and networks of the professionals supporting our military service members and their families. Please note the views expressed in this presentation do not necessarily reflect the official policy of the Department of Defense, U.S. Department of Agriculture, and U.S. government, or OneOp. The mention of any entity or product is for informational purposes only. I'm getting ahead of myself with these presentation slides. My apologies. I'm excited to present to y'all Carmen De Leon. Carmen is a director of case management with special needs programs for the Defense Health Agency, and she's with the TRICARE Health Plan. She's clinical oversight and integration section that she's over. Ms. De Leon's roles and functions as the DHA nurse consultant or subject matter expert for case management and special needs programs. She's also the clinical program lead for the extended care health option, which we'll be focusing on today, and the exceptional family member program for beneficiaries in CONUS and OCONUS areas. Ms. De Leon also serves as the liaison between military treatment facilities, intermediate service commands, uniform service headquarters commands, Veterans Administration, TRICARE eligible beneficiaries, the managed care support contracts, and the Uniform Services Family Health Plan. So we're really excited that Ms. De Leon can share some of her expertise with us this morning as well. And just as a disclaimer, we wanted to put this in for time's sake today. We understand that this is a very important topic. We may be unable to address personal TRICARE questions or individual scenarios or case-specific concerns, but please note that this presentation is going to be for informational purposes only. Attendees with personal inquiries, we're going to be able to direct you to the appropriate TRICARE representative or resources to provide you that further assistance and time that you need to answer those specific questions. So please, I hope that's not a deterrent here. For time's sake, we're going to focus on information purposes and kind of a broader TRICARE echo. So we welcome any of those questions that you may have, and we encourage you to ask questions or provide comments. If there are more personal scenarios that we're unable to get to at this time, we'll make sure that we find the necessary person who can assist you. So without further ado, I'm going to go ahead and pass over the presenter reins to Ms. DeLeon at this time. Carmen?
Thank you, Rachel. Good morning, everyone. As Rachel mentioned, I'm going to do a brief overview of the TRICARE Extended Care Health Option, which is also known as ECHO. Next slide. So these are some of the objectives listed. Just going to go over each of the little topics just to kind of give you an idea of what ECHO is, the eligibility, registration, and some of the other things associated with the program. Next slide. So let's begin. What is ECHO? ECHO is a TRICARE benefit as is stated in the Code of Federal Regulation, Title 32 for the National Defense Civilian Health and Medical Program of the Uniformed Services 199.5. It does supplement the TRICARE Basic program, and all the benefits through the Basic program are excluded under the ECHO program. It does not provide acute care nor benefits available that I mentioned under the Basic program. ECHO pays for services and supplies designed to reduce the disabling effects of a qualifying condition that is not covered under the regular TRICARE Basic Health Plan. Next slide. So ECHO, it is available only to active duty family members. It does provide some financial assistance to the beneficiary with a qualifying condition that could be moderate to severe mental retardation, some type of serious physical disability, or a physical or psychological condition that deems the beneficiary homebound, or may even be some type of special education related to an autism spectrum diagnosis. The cost share by the government is $36,000 per calendar year for certain benefits that are available through ECHO. The cost share does not apply to another part of the ECHO benefit, which is the ECHO home health benefit. Next slide. There is a sponsor cost share, and it is based on the pay grade of the sponsor, regardless of the number of dependents that are in the ECHO program. The ECHO benefit does need what we would say pre-authorization or an authorization before a service is rendered. So you need authorization and approval before any ECHO services are obtained. Once ECHO has been completed, the registration for ECHO is completed, it will be put into the DEERS system under a special code, which is the Healthcare Delivery Plan Code 400, which will show that ECHO is available for the particular beneficiary. Next slide. ECHO is a voluntary program. It does require enrollment through the U.S. Family Health Plan, which is USFHP, or the regional managed care support contractors, which in this case for the West region is TriWest, and for the East region is Humana Military. Under USFHP, there are 6 designated providers throughout CONUS that are also available for enrollment and then potentially ECHO benefit registration if criteria is met. It does require a referral to the contractors, which is through the USFHP or the managed care support contractors from the primary care manager. It also requires enrollment in the EFMP or Exceptional Family Member Program, which is required per branch of service guidelines. Next slide. Who is eligible? Overall, it's a family member of an active duty, but that could be a spouse or a dependent child. It could be an active duty family member with physical or psychological qualifying conditions. Active duty family members must be in TRICARE Prime or TRICARE Select. Reserve component members are also eligible if they've been activated for more than 30 days, which puts them in an active duty status. A transitional survivor for the spouse and children. A transitional assistance management program, which we call TAMP, is also eligible for ECHO. That's usually on the active duty sponsor's orders once they get ready to transition out of the military. Next slide. So now we get into how to register for ECHO. As was already mentioned, active duty sponsor must be in the EFMP per branch of service requirement. Like I mentioned, it's something that is mandated by the services. It's a non-medical program designed to provide information and non-clinical support for the family members, the active duty family members with special needs, ensuring that if they are to move to another location or even at their current location, they can receive the care and support that is needed. I've included a link for installations so that if someone needs to find an EFM enrollment location, that link will better serve and give ideas of where an installation, the closest installation may be found to get EFM enrollment started. Next slide. So also as goes along with the registration process is the sponsor should contact the contractors also, whether that's the USFHP folks, the managed care support contractors, or even the overseas contractor, which is International SOS. The following will be needed is proof of active duty status. That's also going to be connected to the DEERS. Any medical documentation for qualifying condition for the beneficiary that is getting registered in ECHO, and then proof of enrollment in the EFM program.
Ms. De Leon, is there a waiting period after enrollment before services begin?
Yes, and I'm going to get that into the next slide. I think it's right after this. It's not necessarily a waiting period, but I'll get into what we call a 90-day provisional period.
Okay.
Next slide. And there it is. So the 90-day provisional is somewhat considered a waiting period, but you're not waiting necessarily for services. It's just the 90 days that is provided so that there isn't a delay in ECHO services while the ECHO registration requirements are obtained and completed. So it does authorize and make payable ECHO benefits for the 90 days. And then the provisional status does end upon completion of the registration, or if nothing gets done, or nothing gets completed, then that 90-day period will end, whichever one comes first. If you get the registration before 90 days, then everything goes on. If things aren't done by the 90 days, on day 91, services end, and the government will not recoup any type of claims paid for the ECHO services during the provisional period. We do understand that it takes some time for for EFM documentation to be either obtained or to even get into the EFM program. That enrollment process is taking on average about 30 to 45 days, but you never know. There, life happens and things may take a little bit longer, but that 90-day cushion, as I like to reference it, gives that period of time to get all the necessary documents that may be needed to get into the ECHO program. Next slide. Here's a list of some of the ECHO benefits that can be provided throughout. Please make note that it is limited to the United States, CONUS, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands. Once we get to the OCONUS area, those are a little harder to obtain, and there's certain services that will be available and certain services that won't be available. As was mentioned, you all can read the slides, but essentially it gives a lot of, maybe some durable equipment, medical and rehabilitation services, some incontinence supplies. There is some in-home respite services. There's some training that can be provided and assistive technology devices that could be provided. If someone is in an institution, then there is that transportation available back and forth to other locations if someone is institutionalized, and getting some additional ECHO benefits through that.
And Ms. DeLeon, not assistive technology, but can ECHO help pay for those home modifications or vehicle adaptations?
Home modifications, not too many are available. There is some, again, depends on what's going on with the individual requesting it. We have had some portable ramps that they may assist with, and maybe some vehicle modifications like a lift or something like that that could be looked into also. So it's very case by case, but there is some assistance available there. It's totally different than what the VA would provide. Nothing permanently structured in the home is part of this program. But like I said, there is a portable ramps that I've been told, and of course some durable equipment that may assist the family, like maybe a special bed, a special wheelchair, things of that nature. It just depends on what the case is about, and they will look into that.
And can
that
you
also will require, I'm sorry, just a minute. That also will require a referral from the primary care provider to the managed care support contractor. If ECHO benefits, if they're part of ECHO, then they can look into some of those things to see if that's something that can be covered. Rachel, you had another question?
Yes, ma'am. You have medical and rehabilitative services as one of the ECHO benefits. Can you clarify, and you may get to this as well, is there coverage for applied behavior analysis or ABA therapy through ECHO?
It is not through ECHO. What is the requirement, and I am going to get to it in a little bit. ABA is a TRICARE basic program type benefit. It's under a demonstration, so it's not officially a TRICARE basic program, but it is a benefit. Active duty service members, and I'm going to get to this, they must, it's mandated that they be enrolled in ECHO in order to get ABA services. So I'll get into that in a minute and why that is a requirement. But medical and rehabilitation services in this instance is referencing stuff like physical therapy, occupational therapy, speech therapy, where under the basic program, they may need, I don't know, just for sake of discussion, 10 different treatment sessions, and then to prevent the individual from regressing, they may provide an additional 10 or 15 just to continue keeping the member at that same level, if not improving that, so that they don't plateau per se. If they weren't in ECHO under the regular medical benefit, after whatever number of sessions, if it wasn't deemed medically necessary and they weren't making progress, that therapy would end. It could potentially continue under the ECHO program because of the qualifying condition that the member may have that is in the ECHO program.
Thank you for that. We also did just have a little bit of back and forth in the chat. An individual asked if a service member is deployed, does the spouse need a power of attorney to sign up for this? And another respondent mentioned as soon as a family gets their DD 2792 filled out by their PCM and their DD 2792-1 filled out by the school and signed and dated IEP is provided to the EFMP office by the service member or spouse. A family caseworker can expedite the review to, in this case, the Marine Corps headquarters. So that was just a comment.
Power of it, all of that information is very valuable because, I'm a retired spouse, and it's always a good idea to have a power of attorney if your sponsor is away. But in the interim, that information with the 2792s is important. Work with the EFM offices. If your member is deployed, you do have power of attorney. They should be able to work through the process to get the EFM information that's needed to get into ECHO if that's something that happens while the sponsor is deployed. So work with the offices and make sure that everything that is needed. You never know what develops if someone is deployed. It could be a deployment for a couple months. It could be deployment for a year. And that, of course, you need to be able to access care and all the necessary information that is needed. Filling out the 2792s is also very valuable. And that's what the EFM offices are going to need in order to ensure that a qualifying condition for their program is there. And then it moves on to the ECHO so that they can validate that they're in EFM and then also obtain ECHO benefits if it's so needed.
Do you happen to know if that's a special power of attorney or just a general power of attorney?
If I recall, I did all of that. I did both because it's general and medical and all those things. So I don't know exactly which one you need over the other, but I would definitely recommend that be something that you have, especially if the sponsor is leaving the country.
Thank
or
you.
even the state.
Thank you.
Any other questions?
There are a few more coming through. I'm going to let you get through a couple more slides, then we'll get to them.
Okay, next one. Next slide. Okay. Here's some additional information on the ECHO home health benefit. As you recall, in early part of the presentation, I mentioned the $36,000 cap for the ECHO regular benefit. And then the ECHO home health benefit is a little bit different. It is required that the beneficiary be homebound. It is for skilled nursing services, and it is capped on cost, which is based on location versus what it would be for the $36,000 that was mentioned for the regular ECHO benefit. Any services provided under the home health benefit must be a TRICARE authorized home health agency certified by Medicare or Medicaid. So CMS guidelines or Center for Medicaid and Medicare are the ones that actually must be in that program in order to be part of TRICARE coverage for the ECHO home health benefit. Let's see, it does require something from the primary care provider, especially asking for the service, and then of course validation that this beneficiary requesting these services is truly homebound. There's specific definition for that. That is in our TRICARE manuals. I didn't put it on this slide, but our managed care support contractors are very well versed and so are the clinicians as to what is the definition of homebound, which means they're pretty much homebound. They don't go out for very many things, maybe some doctor's appointments, maybe some religious services, but they're not out and about like everyone else might be. Or it's very taxing if they do. Next slide. Here's some additional information on the ECHO home health benefit. As I mentioned, it is capped by cost, not by hours. It is similar to a skilled nursing facility reimbursement rate. So if somebody was in a skilled nursing facility, but we don't want them or they would rather have them at home, then this is what this is for. It is still, the home health agency has to be certified by Medicare or Medicaid. It's limited to part-time, or it's not limited to part-time or intermittent. So in the regular TRICARE basic program, we do have a home health nursing skilled service, but it's not to the level of what this provides. It is intermittent, it's part-time, they go in, they do what needs to be done, they teach the family. You know, it's usually after an acute care episode in an inpatient facility, and then they're done. And it's only so many hours a week, whereas this provides a little bit more coverage on a day-to-day basis based on the location of the individual. In addition to the ECHO home health benefit, there's also an ECHO home health respite care benefit, and that also could be for skilled or maybe someone who requires frequent interventions and requires some kind of training, but not necessarily a skilled intervention, which means it may not be as intense as it would be someone in a regular home health care aspect, but it is respite care. So it comes out to about 40 hours a week, which the ECHO home health care benefit may be a few more hours. And our managed care support contractors, along with the provider, work very closely to determine what is the better coverage needed based on the amount of skilled intervention that the beneficiary may need at the time. Next slide.
Ms. DeLeon, we do have a few more questions if we can take a pause for a moment and answer some of them that have come through.
Sure.
One of them being about some of these benefits that you're going over. If a National Guard soldier is deployed, for how long may the family member use the services after they come back?
When they're off active duty orders, they're no longer eligible for the benefits. They have to be on active duty orders for greater than 30 days. So day 31 starts the potential benefit. And then after that, if they're gone 365 days, then on 366, it's no longer going to be covered. So it all depends on what the orders say and when they get on active duty and when they get off active duty.
Thank you. And how long of a turnaround is it normally for an ECHO case manager to contact a family once they have the PCM referral and proof of enrollment in EFMP?
So they usually get contacted within probably 5 to 7 days. It just kind of depends on when they receive it. But there is that, you know, proactive coordination that if a family member is aware that that they're requesting it and they're needing it, it's always a good idea in my mind, and I always provide this recommendation, is if the sponsor knows that they're potentially ECHO eligible, and they know that things are moving forward by the primary care provider, then call the managed care support contractor and let them know that their family member is needing some ECHO services. And then a case manager will start working with the family to make sure that, one, they get the referrals, and also that they get the necessary documents needed, like the EFM validation, or if you don't have the EFM enrollment forms yet, that you connect with an EFM person to get that information. So it does vary. Don't hold me to the 5 to 7 days, but we have been very successful through our managed care support contractors to make that connection with the sponsors or with the spouse of the sponsor who's maybe the primary caregiver requesting that information. Always, like I say, being proactive is never a bad idea. In fact, it's a great idea to make that connection and start that communication and collaboration to get these services sooner than later.
Thank you. And I know there was a question, and I'm curious what your recommendation might be in this scenario is if an individual or if there's a process that you would recommend that a case manager should follow if a family's reporting what is essentially kind of a standoff between ECHO and Medicaid for respite care. Do you have a process on how they should follow in order to provide services?
We do not have any say in the Medicaid program. It is a state program. There may be some documentation that Medicaid requests that case manager might be able to assist with, but we don't coordinate any of those hours. We don't have anything to do with the state program. We're at the federal government level, and so the case manager might have some resources, but we don't have a process in place to make that connection. We don't reimburse Medicaid for whatever services are being provided. That is totally on the sponsor and the family to get that coordinated with Medicaid. We take care of whatever the member may be eligible for under the TRICARE program for ECHO.
Thank you for that, Ms. De Leon. And we have another question. Will ECHO accept the EFMP enrollment letter that an EFMP family caseworker can fax during that 90-day provisional time while waiting for the DD 2792 medical packet from the family member?
Probably not, because a letter saying I'm working on EFMP is different than saying I am in EFMP. Now, what is being accepted is once everything is completed and you are enrolled in EFMP, then the services have gotten together and have put together a letter of validation saying Sergeant whoever, child whoever, spouse whoever is in the EFM program. But if it's I'm working on it, that's not going to be enough. The 90-day provisional is one thing, but it's not going to suffice. You have to finish the documentation process and the requirements for EFM, which is the 2792 and the 2792-1.
Okay, thank you.
Because then on
And
day 91, those whatever might have been under the provisional will end.
okay, I know we have a few more questions that have come through. We'll hold off again for just a second, but we will get to them. And I know there was an individual that had a question about TriWest. There is a slide coming up in the near future from Ms. De Leon that she'll be covering TriWest. But those of you that have questions that we haven't gotten to, hold off. We will get to them. I'm going to let Ms. De Leon get through a few more of her slides, and we'll take another little break and go through some more questions.
Okay, so next slide should be ECHO respite. Is that what you have on your screen? So the regular ECHO respite, as I alluded to earlier, is a 16-hour per month benefit. It's not the one under ECHO Home Health, which required skilled or frequent interventions. It does provide a break for a primary caregiver. Back in 2001, I include this for those that may have heard before, that there was a requirement for a concurrent ECHO benefit to be done within the same month that ECHO respite, the 16 hours, was requested. That is no longer required. So if you're ECHO eligible with a qualifying condition that met criteria, and you request ECHO respite as the only service that you're requesting at the time for that month, you can still get it. It does have to be provided by a TRICARE authorized home health agency, certified by Medicare, and I forgot the or Medicaid, as was earlier mentioned, as part of the requirement for home health agencies. Next slide. I'm going to briefly get into the comprehensive autism care demonstration, which is the ACD program for ABA therapy. So active duty family members under the demonstration must be enrolled in ECHO to receive services under the demonstration. If you don't get into ECHO, you're not going to get ABA therapy. This allows visibility for the active duty family member in the event that something needs to change as far as a PCS move, so a change in duty location or things of that nature. It ensures that the services are aware that there is a special needs family member. There are some other services through ECHO that can be obtained, like incontinence supplies or maybe some additional rehabilitative services, as I was talking about PT, OT, and ST. But this is the requirement for the demonstration. It's a little bit different than the TRICARE basic program, but again, it's a mandate for the demonstration that active duty must be enrolled in ECHO. Next slide. Now I'm going to talk a little bit about care coordination. This may be something you all have encountered, or maybe it hasn't. But when we have family members that are moving from one location to the other, it is essential that through communication, collaboration, and coordination between the losing and gaining areas, whether that be the MTF, the markets, the uniform services, the EFM representatives, the contractors, which is either through USFHP, or the regional contractors, which is TriWest or Humana, all of that needs to be notified. They need to be notified that these things are happening, because a pending move could disrupt some care, and we don't want that. So we really emphasize the need for the collaborative effort between losing and gaining locations, whether that be in the civilian sector or at an MTF. But the resources available through the EFM representatives and the uniform services and our contractors is key. With some of our more complex cases, we do hold some care conferences between losing and gaining to make sure that some of the services that are being obtained at the losing location can be available at the gaining location. And if anything needs to be set up ahead of time, then that can be worked through, hopefully sooner than later. We like to know about these probably no later than 3 to 6 months out. Some people get a hold of their case managers early to let them know what's going on. The services, the headquarters are real good at the EFM offices to ask questions also that somebody's getting ready to move. There is currently a region-to-region transfer process for those that are in ECHO, and it really is a little bit more utilized for those more complex medical conditions. And as I mentioned before, through coordination and timely notification, case managers do facilitate the transition of care and their needs at the new location prior to the move to the next region, or even if it's within a region. Next slide. Here's a little bit more on the care coordination process. It kind of reiterates what I've already mentioned. It is important that the losing and gaining communicate with each other and collaborate and coordinate the care that may be needed at the next duty station. Sometimes the utilization of directed referrals can be used from a PCM, but again, if notification isn't made, these referrals aren't going to be utilized there because nobody knows that someone's moving or that they're coming. So it is important that that happens. Once relocated, a new primary care provider, primary care manager will update the referrals, when needed, so that continuity of care can continue at the new location. Again, I can't emphasize enough about the timely notification by the services, by the sponsor of the pending move. It's very, very important. And when that happens, it goes very smoothly, and we've had a lot of success in getting that coordinated appropriately. Let's see, gaining and losing location processes are outlined in the EFMP PCS care coordination guidance. On the EFMP site, if you look at Military OneSource, there's some, resources available if someone is getting ready to move. Also, we highly recommend that the sponsor talk with the EFM program navigator, coordinator, whoever it may be, to let them know, and they should know, because EFM program is there to help the active duty family members ensure that they have what they need at the next duty station. Next slide. A little bit more, I can't emphasize it enough. Notification by the losing to the gaining. The referral process can be utilized if they're notified ahead of time, because the contractors get involved. They see what referrals are out there and what they're utilizing what services are being utilized and what may be needed at the next duty location. Let's see. They can help coordinate an appointment with a new PCM. They can help identify a new PCM, especially if they're TRICARE Prime or within an MTF. And then, of course, they do update the referrals as needed once they get in their next duty station. For beneficiaries with more complex medical needs, especially those that are in ECHO Home Health, a new address will be needed. The skilled nursing services will need to be coordinated at the next location. And then orders, of course, from the PCM to ensure that they have the same type of services. They try to get appointments within a week with the new PCM so that everything is, these are family members that have much more complex needs, are homebound, are getting ECHO Home Health services. So we want to make sure that everything is not only available when they get there, but that they're doing well when they get there. And then, of course, once they do get there, they do need to enroll in the new region if that's a new region for the family. Next slide. These are some points of contact. I know there's some more questions, but I'll just go over them quickly, and then maybe we can go over a few more questions that are still lingering. The East region is Humana Military. There's their website. There's their 1-800 number. The new region, the new contractor is Tri-West Healthcare Alliance. They are covering the West region. There's their contact information. There's also the U.S. Family Health Plan, member service representatives, their contact information, and their 1-800 number. There's also our International SOS, which is our overseas contractor. That is also some contact information if needed. Next slide. Here's some additional resources. Under the TRICARE.mil changes, it'll show some of the states that are moving. There's 6 states moving from the East region to the West region to kind of make the numbers for each region a little more equal. You can go over that. There's also some ECHO information on the TRICARE.mil site for special programs, and it goes into a little bit more about the ECHO benefit and just a little bit more about the program that I may not have gone into great detail about.
All right. Well, Ms. DeLeon, we're going to, at this time, answer some of the questions that we didn't get to. If after we go through these questions, if we're running out of time, I'm going to go ahead and post my email address in the chat here shortly when Ms. DeLeon is responding to some of the questions. So if we don't get to everyone, email me your questions and we'll try and get them answered or send you to the right person who can get them answered. But one of the questions that came through, if you can briefly just go over, during the PCS, will enrollment transfer to that next duty station?
I'm sorry, repeat the question. The EFM registration?
Sorry, during PCS, will enrollment transfer to the next duty station? So
What enrollment? ECHO?
I'm assuming they're
EFMP?
ECHO, EFMP, ECHO enrollment.
So ECHO enrollment, as I mentioned earlier, under the DEERS, there's a little code that says you're ECHO enrolled 400. There may need to be some additional coordination between the losing managed care support contractor and the gaining. You don't have to re-enroll, but they do need to share that information so that the gaining can see what kind of ECHO benefits were being obtained from the losing contractor. So it's always great to talk to your echo case manager or your medical case manager to make sure that they're aware that you're moving, because you don't have to go through the whole, let me repeat my 2792 and all that stuff. You have to do it anyway by the service mandate requirements every 3 years, I believe, or every year if things are changing. But please notify your case manager that that you're getting ready to move to another area.
When you were going back and talking about some of the benefits, and one of them being respite care, um, how does an individual actually sign up for that respite care? Because in their situation, a case manager said it's not through them. How would someone sign up for respite care through Echo?
A referral from your primary care provider is needed. If somebody can give me information on who said it isn't through them, I would love that information, and you can send it through Rachel to me, because if they're eligible for Echo, they are eligible for either the Echo respite, which is the 16 hours, or they may be under the Echo home health benefit. It just depends on what they're asking for. Now, please be aware that the uniformed services, the Army, Air Force, Navy, Marines, they do provide a type of they do provide a type of respite service, which is totally separate from us. And if that's what they were asking for, then it's not going to be through us or the managed care support contractor. It's going to be through the service, the branch of service.
Thank you for that. And then we had several questions regarding TRICARE West. And I don't know if you can provide some clarification, but a few of them were just regarding, is TRICARE Echo going away for EFMP families and Tri West under the new contract? Um, any
Absolutely not.
okay. Okay. And then is there was a question about EFMP Western Region getting through to Echo. Is there any guidance or suggestions that you have
Yeah.
for TRICARE West recipients getting Echo services?
The process should be the same. I do want to be transparent, and right now, TriWest is working on getting everything situated because it was a huge lift and change. The benefits aren't any different in the West region as the East region. So continue to make that coordination with TriWest and the numbers that I provided. You can ask for the Echo department or ask for case management to kind of get that started. They should be available, and there are resources. If you can't get somebody, then definitely, if you have an old case manager, talk to them. If it's a new case manager, they still need to work through that process because the benefits are the same in all the locations that I mentioned.
Then kind of going back to the TRICARE West bit, can that benefit be shared with multiple eligible dependents?
I'm not sure what that really means, but every family member eligible for the ECHO benefit gets their own benefits. It's not shared. But what is shared is if there is one sponsor and they have 3 or 4 family members that are eligible for ECHO, then it's just one cost share for the sponsor's grade. So in that regard, that cost share a month is only based on that one sponsor's pay grade. But if they have 3 or 4 different eligible beneficiaries, then each beneficiary will get their own benefits under ECHO as needed. Does that make sense?
Okay. All right. For time's sake, I know we're getting close to the top of the hour. I did go ahead and pop in my email address in that chat. For those of you, there's still a few questions or just general comments. please reach out to me. I know there was a few of them regarding specific cases that you've or challenges in your area with families. And so reach out to me, and between myself and Miss De Leon, we'll try and get you the necessary assistance or help or refer you to the person that can within TRICARE. But send me that email again. I have gathered any last minute questions that have come through, and I'll make sure that we answer those as well through Miss De Leon. But for time's sake, I did want to get to our CE information real fast with everyone. Um, this particular presentation or today's webinar, we are providing several CE opportunities, many of them coming from either the financial realm or healthcare realm. And so for those of you that are interested, we are providing one CE credit through the accredited financial counselors, patient advocates, those of you that may be case managers that are on, or disability management specialists. Those are going to be some great CE offerings for you. We also have that family life educators, health education specialists as well, family consumer sciences, personal finance counselors, social workers, licensed professional counselors, licensed marriage and family therapists. And then also a unique one that this particular webinar is offering is state continuing education clock hours for Michigan certified teachers. And then if you are just needing a general certificate of attendance for joining today, that is also an opportunity as well for you to get connected. And I will post that link here in the chat shortly for you. Please note when you get to our event page where you can find today's webinar and information and download today's PowerPoint slides. Oh, Kathleen, you're a lifesaver. Um, Go ahead and go to our event page. You're going to see a nice purple button that says Continue Education. You'll click on that. You'll be taken to a survey. You'll complete the survey. You'll then be directed to complete or identify which CE offering you're interested in. And my colleague Kathleen has posted a direct link. So you don't even have to go to our website where the event materials are. You can go directly to that survey right now to complete the survey to identify which CE offering you're interested in, and then you'll get an automatically generated email certificate. If you have any questions, reach out to us at ce@oneop.org for assistance. Um, Amanda, I'm not quite sure what ASWB approval is. The social work approval is national, and then you might have to check with your state of, association, but I think there's only 11 states that it may not qualify, but you would have to check with your state association. Association of Social Work Board. Yes, the ones that you're receiving social work, depending on your state, are nationally recognized and approved. So you should be able to receive CE credit for that social work offering. There's a few states that may not, but we always tell folks just reach out to your state accrediting association because most cases they will still accept it if it's a nationally approved. All right. It's a lot of information I'm throwing out at you, and I appreciate your patience as we go through it. Join us. We talked today about TRICARE Echo. In a couple of weeks on April 23rd, we're also going to have another expert, subject matter expert from the Defense Health Agency that's focusing on TRICARE autism care demonstration. Again, we're really honing in on um, month of the military child, and especially in our realm or audience that we work within OneOp lifespan caregiving, it's those individuals with disabilities. And so join us in a couple of weeks where we are going to be focusing on insights to eligibility requirements, covered services, the enrollment process, and how to better equip family members and guide them in accessing and utilizing these benefits. I don't know if you're familiar with Dr. Kristen Biena, but she has presented for us before and does an excellent job. And so she will be available and is going to be our subject matter expert in a couple of weeks. Kathleen has, again, if you're needing that direct link for CE offerings, she has posted that link, that direct link to CE information here. Um, And then I'm also going to go ahead and put a link to our April 23rd webinar on TRICARE Autism Care Demonstration, so you can join us. Um, and Dr. D, the link is not in the chat. Maybe she can send it to you directly. Oh, okay, let's see here. Let's try it again. Thank you for bringing that to our awareness link to survey. All right, so you should see the direct link to the survey in the chat now. And again, if you have any questions regarding CEs, and I'll go back to that page for you real fast. So if you have any questions, reach out to us at ce@oneop.org. And again, if you had questions, and I know there were a few that have come through or comments regarding specific scenarios in your area, feel free to reach out to me. Like I said, I know we're kind of on a time limit here, but reach out to me and I'll work with Miss De Leon, and we'll make sure to try and answer those or get you sent to the person that can answer those questions for you and provide assistance. We appreciate your time today so much for joining us, sharing your comments and questions. I know there were a few times several folks provided their own responses or comments to other people's questions, depending on their area or their service branch. So I really appreciated y'all sharing and connecting in that chat as well for us. We'll stay on for about a minute or two to close out with any last minute resources that you're trying to gather or links. But again, appreciate your time today. Hope you have a wonderful rest of the week. Stay tuned. Join us again on April 23rd.